Welcome back, YouTube family. Before I begin this news story, remember to hit the notification button, like and subscribe to my channel to view relevant content. I hope everyone is having a wonderful day. Research on Botox and dementia has been a hot topic in recent years. The use of Botox, a neurotoxin made from bacterium, Clostridium botulinum, has become increasingly popular for cosmetic purposes, as well as being studied for its potential therapeutic uses since it was FDA approved in 2002. Ongoing research shows that unintentional and shocking results shows that the Botox injections in the forehead and face rearranges the brain sensory map of the hands. So while youth-conscious clients are receiving Botox injections to reduce facial lines and wrinkles, their procedure affects another area of the body. The toxins in Botox paralyzing muscles by blocking the release of, which is a principal neurotransmitter between our nerve and muscle. The segment of months when there is paralysis deprives the brain of sensory inputs, usually generated by the facial and forehead movements. Both of the client's hands will experience a decrease in cortical brain activity after the loss of facial movements. Depending on the Botox dose, there are minimal to significant changes in brain remapping. Oftentimes, the changes to the body are not readily seen without close observation, MRIs, and testing over time. It's mandatory that each client thoroughly researches the expertise of the medical professionals, such as an MD, physician's assistant, NP, or RN. Also, Botox is centered on the face, and there are additional effects and changes within the nervous system as well, according to some neurology articles. Centuries ago, scientists discovered that our brain circuits and its anatomy are malleable, constantly changing. We are always receiving new information, whether through reading, demonstrating a task, learning how to use an instrument or tool, etc. Our brain maps of the head and face are right next to each other. Since the Botox injections are strategically the same place during the ongoing treatment every 2 or 3 months to years, which forms permanent changes to each client's brain. In current times, studies have explored whether or not there are any connection between the use of Botox and dementia risk. The results of these studies are mixed. Some suggest that there may be an increased risk associated with long-term exposure to high doses of this toxin, while others find no correlation at all. A few reports even suggest that low doses could potentially reduce symptoms associated with Alzheimer's disease or other forms of dementia by blocking certain pathways in the brain involved in memory formation and recall. However, more research needs to be done before definitive conclusions can be drawn about how exactly Botox might affect clients' cognitive health over time. It is essential to remember that although research into this area continues yearly, we still don't have enough information about the effects on our brains yet. Anyone considering using this product should consult their doctor first, just to make sure they understand both potential benefits and risk before making any decisions regarding treatment options. Yes, clients who are glamour conscious will have less wrinkles, which gives them youthful appearance. However, we must all take care of our insides. These organs are constantly at work as we age. By using unnatural substances, especially if considered poisonous, think of the breakdown of your health over time. There's been only 36 cases of adverse effects reported to the Food and Drug Administration to date, so they say. Most doctors and reports will state that there's no long-term or life-threatening adverse effects of Botox. However, every client is unique and must consult with their doctor pertaining to what's going on in their body before receiving even one injection. Lastly, if the live bacteria goes into the bloodstream, it will attach itself or cling onto muscles and replicate, weaken, or fully immobilize those muscles. Keep that in mind, everyone. So please leave your comments below, and remember to hit the notification button, like and subscribe to my channel. Thanks for coming back, and thanks a million. Be safe.